Hello and welcome to our webinar on pharmaceutical marketing taking action. My name is Dimity and I'm a communications advisor at Health Action International. We are going to be streaming this webinar live on Facebook, so bear with us as we set this up for a couple of minutes before Paul begins speaking. While we do, I wanted to take you through a few features of the webinar. At the end of the webinar, we will have a Q&A section, so please feel free to ask any questions throughout the webinar by clicking on the Q&A icon at the bottom of the screen. We will also be holding similar webinars in the future, and we'll continue to distribute content related to pharmaceutical promotion. So please let us know if you consent to us, Health Action International, emailing you on the email address that you've registered with by selecting either yes or no in the poll that I'm about to post now. I can see a few of you have already answered. I'll just wait a couple of minutes so that everybody can answer. I'll keep that up so people can continue to answer. We also want to know if you consent to Formindep receiving your emails as well to contact you about similar information related to what he'll be talking about, what Paul will be talking about throughout the webinar. So once I've finished this current poll, I'll launch a new poll that will ask if you consent to Formindep receiving these email addresses as well. Okay, I've just launched the poll asking if you consent for Formindep to contact you via the email address provided for future events or related content. Okay, I can see that most of you are answering now, which is great. I want to keep this up for a little while longer because I have a third question that I want to ask. Okay, I'm going to end that polling now. We want to know who's actually watching us. So I'm going to post a poll that's going to ask who is here and what your profession is. So I know that we'll probably have a few students here. We'll have some healthcare professionals, academics, advocates, and others, which I'd be very interested to know what the other category is of people who are here. As I'm seeing people voting at the moment, most people have voted at the moment, which is really great. It seems like many of you are students, which is great. You're definitely the people that we're wanting to be speaking to, as well as obviously healthcare professionals and academics and advocates. So that's really good to see. This is great. I can see most of you have voted now. Got a few more trickling in, so I'll end this polling just now. So hopefully you can see those results. As I said, most are students, but we do have a few other people in the room as well, so that's really good. So we'll be broadcasting this to our Facebook Live as well shortly. To let you know who I am, I'm Dimity and I'm a communications advisor at Health Action International. We're an organisation driven by our vision of a world with safe, effective, affordable and quality assured medicines for everyone, everywhere. This is our fourth webinar in our series that provides information on pharmaceutical marketing and what this means for healthcare professionals, as well as considerations for civil society representatives. So far, our webinars have focused on unbiased information on medicines and why this is needed, how medical students are pushing for industry regulation on campus, and how pharmaceutical marketing is using online platforms. For today's webinar, we're joined by Paul Scheffer. Paul is the president of Formindep, and this is a French non-profit organisation which has been advocating for more independence in health, especially in relation to the commercial influences of the pharmaceutical and medical devices firms since its creation in 2004. Formindep gathers health professionals, patients and citizens and is part of the International No Free Lunch Network. Paul will be taking us through the actions taken to counter the influence of pharmaceutical companies encroaching on decision-making of healthcare professionals. So welcome, Paul.
Thank you, Dimitri, and hi everyone. I'm very glad to share with you what we did with Formindep and also with all other organizations. So I will share with you my PowerPoints. And now we are ready. So so the plan is I will begin with a short presentation of the No Free Lunch movement and network, and then pass on Formindep actions on transparency and guidelines. And I will make a focus on medical education and what has been done so far worldwide on this topic. And we will finish with question how to get more involved in all these actions. And I really hope that it will give you, for some of you, the desire, the wish to participate to all of these things. I just wanted also to speak a little bit why we need these actions, because certainly you know that the pharmaceutical industry is really strong and efficient to influence prescribers and also politicians and lawmakers and regulation in many ways. So I wanted just to put a little introduction on that to remind that there is no evidence of net improvements in prescribing. And there is also negative outcomes associated with the interactions between physicians and the pharmaceutical industry, like inability to identify wrong claims about the medication, rapid prescription of a new drug, which is not really a good thing, increased prescription rates, and prescribing fewer generics but more expensive medicines with no added therapeutic value. And the fact also is this question, who is influenced by these strategies? Because we have a lot of research articles showing how the industry influences prescribers, but there is always the possibility for one singular medical student or health professional to say to himself, I'm not concerned. That's the other one who are concerned by this influence, but I'm smart enough to not to be influenced. And there was this research shown in 2001 showing that it's certainly not the case, and it's certainly a belief, because when the question was asked, how much influence do sales representatives have on your prescribing, the majority were responding no. But when we were asking the question, how much influence do sales representatives have on other physicians prescribing, the majority were saying a lot. So these people were saying that they were not influenced by others were. So that's certainly a kind of problem. But I won't take much time on this because, as you know, as Dimitri told, there were already webinars on this topic, and I really encourage you to see them if you don't have watched them already, or the Health Action International webinars. And I also want to stress, to underline the document Fact or Fiction that Health Action International has also published. It's a very good synthesis on all these influences of the pharmaceutical industries. And also the World Health Organization and Health Action International manual, Understanding and Responding to Pharmaceutical Promotion, a practical guide. It's a very, very piece. It was done for medical students and pharmacy students, so it's also an important document. I also wanted to remind that there are many actions, researches which have been done on this topic in the last decades. And for instance, this stand of the World Health Organization already in 1988 with this ethical criteria for medicine drug promotion. And there are many principles for member states to follow already in these documents. And in 30 years later, the National Academy of Medicine in the United States published this also very important piece, Conflict of Interest in Medical Research, Education and Practice. And they were really telling that there were many, many concerns about this influence. So it shows that 30 years later, it was not really fixed by politicians. And that's also why we need this no-fluence group. So now we are beginning to speak about this no-fluence movement. It began in the United States in 2000 with the internist Bob Goodman in New York. And it was a way to gather doctors to refuse money, gifts, and hospitality by the medical industries, and also to advocate for less involvement of these drug companies in medical education and practice. And so there is this little cartoon. It's a jungle out there with this box, and I'm a bit suspicious. In my experience, there's no such a thing as a free lunch. And after that, at the beginning of the 2000 years, there were different no-free lunch groups which have been created around the world. For instance, in France, Formindep was created in 2004, made this in 2007 in Germany, and so on. And I put this photo of the first international meeting of the no-free lunch network. It was in Berlin in 2017. During 3 days, there were around 300 people coming from 13, 14 countries. It was very, very nice to be there. I had the chance to participate, and so give a kind of image of what it is now today. I also put a little list just so that you know which group are existing. So in Asia Pacific, you have 2 groups in India, and you have also 2 groups in Australia with healthy skepticism, which exists since decades, and who joined the no-free lunch group also at the beginning of the 2000 years, which is a very important also action. In South America, you have Médicos Sin Marca in Chile, Médicos Sin Marca in Colombia. And in the United States, you have also several groups like Farmed Out and No-Free Lunch USA, National Physicians Alliance USA. And in Europe, yeah, as you can see, we have also several groups. So I already talked about Metis in Germany. I put the logo because I like it. My essentially steps means I will pay for my lunch. I like also this sentence. Metis Austria, Lega Juden Sponsor in Denmark, also in Spain, No Gracias in the Netherlands, in Italy with No Gracias Pagoyo, No French Polska, Pharmaway in the UK, but it's no longer active. But maybe some of you after this webinar will say, hey, it would be a good idea to make it alive again. It would be very great news. And Formindep in France. So you have a list in the Metis website if you want. So now we are we will talk about Formindep actions, give examples of what these non-financial groups are doing. And I will start with actions on transparency. And then we in France, we are using quite a lot legal actions to bring changes. And for instance, we made an appeal. We did an appeal to the Conseil d'État, which is the French Supreme Court for Administrative Jurisdiction, in 2007, because there was a law in 2002, the Kouchner law, and there were not the decrees so that the law will really get in action. And so we waited 5 years for this decree, but there were no coin. So we did this appeal, and in a few days, this decree were signed. So with legal action, it can be very, very effective. And these decrees ask for doctors to disclose their link of interest when we're talking about drugs in public. For the second point, we also did action to verify if this law was respected in 2008, 2009 with a legal action, but this time at the penal court against 9 key opinion leaders. At the beginning, we were following 100 of opinion leaders to see in their media presentation if there was disclosing their link of interest. And we saw that they were not respecting that, and that the Conseil de l'Ordre, so the order, the professional order of the doctors in France, they were also not saying anything. Also, it's better to say that doctors are not respecting laws, are not respecting things. And so we decided to do this action in penal court. It was not us which did it, but another consumer organization. Because for us, it was a little bit tricky to do this action, also regarding the Conseil de l'Ordre, because there are many doctors in our organization. There could be some difficulties with the Conseil de l'Ordre, the professional order. So it's a consumer group which did this legal action based on what we gathered. So the BMJ, the British Medical Journal, did an article in 2009 about that, if you're interested. And now I would like to speak about guidelines, because now it's very, very important, the consequences of guidelines on the medical practice. So maybe you are not so aware, but guidelines are really one of the key targets of the pharmaceutical marketing. It's evidence that there is a lot of implication with if you can put some interesting things for you as a pharmaceutical industry in guidelines, because many doctors will follow this what is written in guidelines after that. And I suggest you to read these two documents. That's an introduction if you want to take a look at that. Why we can't trust clinical guidelines by Jean Lindsay and the BMG, or also the parts concerning guidelines in fact of action from Action International. I also want to stress that it's very, very still active today, this topic. And it's a tweet that I saw a few days ago. Guidelines, reviews, editorials should be restricted to authors without financial conflict of interest, says Vinay Prasad on latest episode of Econ Talk. Vinay Prasad is a oncologist, American oncologist, very, very famous. It did a lot of very interesting articles about conflict of interest and other things.
Paul, sorry, just quickly. I think the microphone might be a little bit coming out and on. Do you mind pulling it out and pushing it back in again? That's okay. I'm not sure if that one is working. I think it's picking up your laptop microphone potentially.
Is it better now?
I'm not sure. We'll give it a go. I just wanted to jump in just in case.
Is it better without the microphone?
I think what might be happening is it's picking up a different microphone. It's picking up the laptop microphone rather than the microphone that you have on your collar. So you might need to change the microphone if possible. But if not, that's fine. We might just need to speak directly to the laptop because it's going in and out just a little bit.
Okay, we can do that. No problem. Thank you. And yes, so so that's an actual, as you can see. And what were the actions of Formindep on guidelines? So it was also legal actions. In 2011, we did appeals to the Conseil d'État again against the guideline for Alzheimer and T2 diabetes, against the High Authority of Health in France. It's the National Independence, likely independent authority for guidelines. And they were both cancelled, these guidelines, after our action. And as you see, another 6 guidelines were withdrawn voluntarily after that by the High Authority of Health. And in 2018, we did an appeal, a new one, and it was more criminal justice, and we did with another organization, which is an anti-corruption organization. They can do this kind of action on criminal justice. They have the authorization to do that. We, Formindep, we don't have it, so it was good to do this action with anti-corruption. And the national authority cancels again from itself its guidelines on this action. So here again, there were some British Medical Journal articles on that, and maybe you will be interested to read them. So I'm done with the Formindep actions. Now I would like to speak about medical education. It's very good that so many students are there today. And maybe you have heard about the American Medical Student Association action, the AMSA, which really started work on this topic. They started in 2002 their farm-free campaign, and now it's called Just Medicine campaign. As you can see, no kickbacks, no speaker bureaus, no free samples, just medicine. It's their logo. And they were leading many actions, and among them, the most famous one is the scorecard, the AMSA scorecard, started in 2007. And this scorecard was about if the medical schools had a policy, a conflict of interest policy, and if it was a good one or not. And in 2007, with the first scorecard, no medical schools at all had very good rates. Nobody was doing anything in this topic. But we really launched the attention and also the media attention on this topic. And as you can see, in 2015, 2/3 of the US medical schools were graded A or B, so the best notes. So it was very effective to make these changes. And you have also this publication down there if you want to go further on that. That's an image to show what how it looks like. It's not a very good quality image, I'm sorry, but it's the only one I could find. And it shows with all the criteria used by the AMSA, and there's a list here, like gifts or conflict of interest curriculum or promotional events. And if the circle is in white, so the medical school was doing nothing for this criteria. Half was doing a little bit, so and full it was quite good. It was good. There were also this publication in the BMG showing that exposure to a gift restriction policy during medical schools were leading to reduction in prescribing newly introduced psychiatric medications. Giving an example that this conflict of interest policy was were effective and important by young doctors on their way to prescribe. So it was effective in the practice in a way. But it was on not so many people, so it was like a kind of first research on the topic. And because this action was so effective, it was followed in other countries. And the first countries which did some scorecards were Australia in 2011 and Canada in 2013. They published their work, and in Canada, for instance, in PLOS-ONE, which is a very famous journal. And but there were not so transformative effects like in the US. And my guess is because it was only a 1-year scorecard, and because no or low medical students were implicated in this work. More academic people who conducted this scorecard. It was really good to do that, but it was not really effective to bring transformations. But I really encourage you to read the papers. And in France, we published also a scorecard in 2017 and PLOS-ONE, but we worked together with the National Medical Student Association, ANEMF, already back in 2014. We started to work with them. And so we got really the official support with our publication. And after this publication, they really asked for change at local and national levels. So it was very, very important to make this work with ANEMF. And in Germany, they also did the same. So they make a publication, a preprint publication about their research on the 38 medical schools in Germany. And they had also a very big coverage like us in France. So it really started the topic to be discussed in Germany. And they are very motivated to bring changes, and so that we can follow the French example. And yes, as it is said, so the work was done with medical students in Germany and France. And now I would like to speak a little bit more about the French example, because we had a kind of different experience as what we could learn from the US experience. So it can be useful for you if you want to do a scorecard one day to have it in mind. Because in France, so at the beginning, when we published in January 17, we could notice that there were no medical schools with any conflict of interest policy. So all medical schools had very low grades. And but the Dean's Conference of Medicines reacted quite well on that, and they decided to publish a national conflict of interest policy, which is a strong one, very interesting one. So we translated it in English, and I put the link here. And I really encourage you to read it if you are interested in the topic, because it's in my view it's the best conflict of interest policy existing today. So it can serve be useful as example for you in your country. And but for us it was a kind of a problem also, because we saw that the most of the deans, they were not so interested to work really on that. They wanted to stop this issue, and also all the media attention on this issue, by putting a very good policy policy, but they were not really ready to act. And so for us, it was a problem, because if we were doing a scorecard on the same criteria, there were all medical schools in France would get an A grade after having an F grade the year before, without having done anything concretely. So there were all medical schools would be perfect on the paper, but without having done anything concretely. So for us, it was not a good thing. And that's why we decided to make another kind of scorecard. And we decided to make a scorecard not on conflict of interest policy, but on the implementation of the ethical charter of this conference. Because I voted, all medical schools in France voted this ethical charter. And now we would like to see if it was implemented. And so how did we do that, this new kind of scorecard? We worked very closely with ANEMF and other medical student organizations, like Residents Organization of General Practice for General Practice. And we sent them a questionnaire, and they answered this questionnaire for each medical school to see if this charter, ethical charter, was implemented or not. And so we published this second scorecard in 2018 with very interesting results. It was showing that there were things who were changing a little bit. It was not very fast, but yes, there were more courses on conflict of interest, and there were also, yes, things which have been well done in medical schools. But there were still a long path to go to be really good. So it was not sufficient.
Paul, I'm just going to interrupt just again for 1 minute to try and problem solve the microphone issue if we can one last time. Would you mind plugging in the microphone and clicking the arrow and selecting external microphone? I'm hoping this might solve it.
So I put the microphone now. I hope it's better. Okay. Yes. So I wanted to know, we were talking about medical education, and I wanted to see that, to say that there is an international dynamic around this issue, and also about scorecards. And for instance, a scorecard has been done in Belgium. Normally it should be published this year. Also a scorecard maybe will be started in Italy, maybe in Austria, maybe in Australia. So yes, there is really a kind of movement around that. And I hope that maybe some of you will be wishing to start one in your country. And there are also very strong signals from the international medical students community with the IFMSA, which is the biggest international federation of medical students association, gathering all national medical students association, not all, but from 130 countries. So it's a very big organization. And also the European Medical Student Association, both published in 2019 a policy document, a policy paper on medical education and conflict of interest. It's really important and interesting to read them. And there is very good stuff in these documents, and it can help national medical association to start something with this backup from this international community. So now we are coming to the last part, and I hope that after this first part, you want to to be more engaged and involved in these actions would be the best news for me. I will especially speak for medical students, because for health professionals it's quite evident that the proposal is to join a no-fluent group or to create a no-fluent group. If you know no-fluent groups which were not mentioned in this presentation, please contact me. I will put my email at the end so that we can exchange about that. Or if you want to create one, we can also maybe help or give some pieces of advice. So please contact me if you want. And for health students, the pieces of advice that I would like to share is rather evident ones, but it's still important to share, to say them, I think. The first thing would be to read and watch more on this issue, because this webinar is really a kind of introduction, but as we said, there are other webinars and there are really good documents that can feed your knowing about all these issues, because it's not only about gifts and about visible things, the pharmaceutical promotion. There are many ways to influence people through science, through clinical trials, or through influence on politicians that doctors don't see. And so it's important to have all this in mind, to have a better critical overlook on all of this. I would also encourage people to get more knowledge about actions in the US, in France, and Germany. And I will also encourage you to join your national or local medical association and ask for change in your medical school. It would be the best thing to do, because you are very legitimate and powerful as medical students to ask for these changes. As we can see, researches and official stands for changes are there since decades. So it would be the good time now to really have these changes. I would suggest you to contact no-fluent groups if there are ones existing in your country, because they could really be helpful to organize events, talks, or to support you for projects on this issue. Like we did in France with Formindep, we helped some medical students for some actions. And my hope is that really some of you would like to launch a scorecard in your country, because that's a very effective tool, like I said. And you can watch the Health Action webinar with Peter Grabitz, who talk about the German experience and action around that. And of course, it would be also very useful to get inspired by other medical student initiatives. And like, for instance, the Harvard medical students, they did a very great action in 2009. There was an article in the New York Times that you can find. It's still online. You will, this PowerPoint will be on Health Action International website. So all the link that you can see on the PowerPoints, you will be able to use them to get access to the articles and other documents. And in Harvard, the medical students, some of them, they noticed that one of their teachers were speaking about anti-cholesterol drugs in his training, and he was talking very on the positive side about these drugs, and not telling the negative sides of these drugs. And one of the students noticed that he had link of interests with drug makers of these drugs. He had contracts with them, with 5 of them, and but he didn't disclose this link at the beginning of this his course. So it was really problematic because medical students were not trusting this teacher anymore, and there was a big movement in Harvard around this action, and it's very good to read that. I would definitely encourage you to read this very important document of the AMSA, which wrote a proposal for a farm-free curriculum, a global curriculum on all the medical education through. It's a very, very good work that I did with references and very good stuff. So for us in France, we really use it because there was not much to change. Also, it's written for the medical schools in the United States first. It was also very very good for us in France. I wanted also to present another medical student action with this leaflet of French medical students. Why should we stay independent regarding the pharmaceutical industry? It's a very little leaflet that you can put in your white coat. And it was about 8-9 medical students who wanted to make a sort of introduction to the World Health Organization and Health Action International manual guide that we spoke about, understanding and responding to pharmaceutical promotion, because this guide is 180 pages. So they were thinking that not many medical students will read it. So they did this little leaflet around 30 pages. And what was very interesting is that they received the prescribed prize in 2015, and there was a very big media coverage on it. And now, and during the last years, it was used by teachers and by other people, and around 50,000, 60,000 maybe copies circulated in medical schools in France. So it had really a big influence indeed. And it really started with a couple of medical students. Now, another also action which was conducted by the National General Practice Residents Organization, ISNA-IMG. They launched 2 years ago a national campaign, No Flinch campaign. And during 1 month, they were asking students not to accept any gifts. And they were also broadcasting some questions and some materials on social networks so that the students could be more aware about this question and issues. So it was a big campaign, and it has also been done the last year, so for the second time. And what is also interesting with ISNA-IMG and ANEMF is that they cut all their partnerships with the pharmaceutical industry during the last years, and they are also achieving to organize their national congress with several hundreds of medical students coming from all parts of France without any funding from pharmaceutical industries. So it's showing that it is possible to organize great big events without any fund of the industry if there is a wish to do that. It's not easy. I think it's not always easy, but they are getting more and more experience in that, and they succeeded in doing that in the last years. So I'm coming to the end of my presentation. And I wanted also to share with you that we wanted us in Formindep, we wanted to organize this year a second international meeting of the North-French network in Paris, but due to the COVID virus, we had to cancel it. But we created with Metzis a mailing list to so that people for the North-French group can exchange more easily. And there is also a storage space so that we can share documents and PowerPoints and also actions that we are doing to get inspired by each other. So I invite you to just to subscribe to this mailing list if you want, if you are interested to get access to it and to exchange with us. It will be also a very good news. So thank you. You have my so the email of Formindep also below. So if you have questions after this webinar, or if you want to be in contact with us, please write to us. Thank you. And now we will have a question and answer time. So I see that there are some questions. The first one is there no French network branch in the African continent now? I'm not aware about it. I know that there were some people from Africa who were there in Berlin in 2017 for the first meeting, from Kenya, when I'm remembering good. I think that the best people to contact to have information on that are Metzis, because they organized this webinar in 2017. And so, yes, definitely you should contact them to have more information on that. So the second question is it a majority or minority of doctors who are committed to these values of independence? And I would say it's still a minority, and that's why it's very important to have these webinars and also to be able to speak with the medical students, because it's very important to talk about that at the beginning of medical education, so that it can be more easy to make changes and to read something about all this when we are at the beginning. So, but it's improving, but it's still a minority. And but I hope that in a decade we can say that it's changed also with you. In France, for instance, we saw that in the 70s there were only 5% of doctors who were refusing drug reps, drug representatives in their office, and now it's more around 30%. So it's better, but it's still a minority. And what we can say also, we see that even the drug industry are saying that young people are more critical. So that's also a good sign. You mentioned a few different actions, very interesting. Were there any other actions Formindep took that were particularly successful or unsuccessful? Yes, I couldn't speak about all the actions and all what we are doing. And we did, for instance, also a scorecard on teaching hospitals, and we published that also in +One. You can find it quite easily. +One, you know, it's all in open access, so yeah, you won't have any paywall for this article. And it was the first one. It was in 2019 that we published this scorecard on teaching hospitals. But there were not so a very strong media coverage. We get an article in Le Monde, which is one of the biggest daily newspaper in France, but it was not as effective as for medical schools. So we will do other scorecards also on teaching hospitals, because it's very, very important for medical education, all what is happening in hospital, of course. What we did also, for instance, another action that I have in mind is during the presidential campaign in France of 2017, we noticed that one of the counselors of Emmanuel Macron for health had a link of interest with Servier. Servier is one French medical pharmaceutical firm, and we tweeted that on Twitter, and we were saying, is this man talking for Macron or for Servier? And this tweet had a very great impact, and this man had to get out of the campaign. So with transparency, sometimes we are getting some interesting effects. And otherwise, we are also concerning journalists. We are giving advice also. We are participating to national hearings from the Senate or from the parliaments. And so, yes, we are trying to broadcast our ideas, analysis, and yes, that's the kind of stuff that we are doing. Are there other movements or initiatives advocating for change? And on the other side, are there pharma companies advocating for the importance of promotion? For sure, there are many other organizations who are doing very great jobs on this topic. Health Action International is a very great example. And there are also, because non-affiliate groups, it's very informal groups, and where many people can participate, but there are big organizations like Health Action International or others. I can think about all the independent drug bulletins that are existing and are pushing, encouraging critical opinions and independence. And it's very, very important for medical students to know that doctors, pharmacists, people since decades try to create independent bulletins to get access to a solid, reliable information on drugs. And like Prescrire, I'm working for Prescrire myself in France, Prescrire International in English. And there is the International Society of Drug Bulletins, which gathers all these independent drug bulletins. They have a website, and you can find if there are any independent drug bulletins in your country on this website. On the other side, are there pharma companies advocating for the importance of promotion? Yes, they are. All of them are advocating for saying that they are doing a great job, that promotion is not promotion, it's information, and yes, they are always saying that they are wonderful, and they are not considering all the bad stuff that they are doing. Also, in spite of also all the problems that they had in court, also in the US court, there were many cases of pharmaceutical industry who were conducted and who had to pay bills from billions of dollars for sometimes, but they are continuing to do their way. Very often, they put money in advance to pay court if needed. So they are prepared to pay court, and they are not paying very much compared to what they are gaining with their marketing. So for them, it's not enough to stop their practice. Thank you for an engaging presentation. It seems to me there are fantastic actions by students and new professionals, but how can we influence the establishment and the World Medical Association, for example, Are the interests at stake too great? Thank you for this question. And yes, it's very hard to get very big change because the pharmaceutical industry is one of the most powerful corporate industry in the world, with bank, petrol, and it's one of the most powerful. So it's very, very difficult to bring changes. But as I said, I hope that, especially with medical students, I hope that there will be some actions, more and more. About the World Medical Association, I know that some of medical students are belonging to the World Medical Students Association as the voice for youth. And some of them, I could speak with some of them who were telling me that they would like to introduce this topic more in the World Medical Association. So let us see if this can happen in the coming years. What is next for Formindep and No Free Lunch? And so for the No Free Lunch network, it's really to get this mailing list and this all the actions that we are doing in our country connected with this mailing list and the storage space I was talking about. And because apart from this first meeting in Berlin, there were, yes, we are not, we are so busy with all what is going on in our country, so it's not easy to know and to take time to know what is happening in other countries. But it would be very, very good that we could do that, because some countries are very, very good experience in one topic about guidelines, about transparency, for instance, and we could help other countries. So this No Free Lunch could help other No Free Lunch groups to go faster and better in their actions. So we hope that it will be happening with this mailing list and this storage space. And for Formindep, we will continue our action on medical education. We will do a scorecard next year, also scorecard for teaching hospital, as I said. And it's also possible that we will do some other legal actions because, for instance, it is in the law that the pharmaceutical industry has to disclose all the advantage and also the contract with medical doctors, because we had the Sunshine Act law also in France, like in the US. So the pharmaceutical industry has to disclose all what they pay to doctors. They are not doing it very well, but yes, we have this law. And normally we should know exactly how much money pharmaceutical industry is giving to doctors for contracts. And till now, we don't know. We don't have these numbers. We know that there are contracts, but we don't know how much money it is. So the law asks for it, but we don't have the number. It's not respected. So we will certainly maybe do an appeal again to the Conseil d'État to get the decrease of application of this law. I'm a medical student. In these scenarios, usually pass the message that pharmaceutical industry are evil industries. Don't you think that this extremism will bring to nothing? Do you really think that refuse to listen to pharmaceutical informants will improve public health? In my opinion, the best improvement we can do is to increase the awareness about bias and right studies. And no, you know, there are many. If you look at the articles written on the topic, and the people like Marcia Angel, for instance, who is the former editor-in-chief of the New England Journal of Medicine, so very important people, they are not telling that. They are more telling that too many doctors are participating to the pharmaceutical marketing, actively as opinion leaders, for instance, or passively by not being critical enough. And what we need is more these investments from the doctors regarding pharmaceutical industry, because you have two strategies. I'm taking the words of Howard Brody, a doctor and a philosopher, who is saying in one of his books that the doctors have two strategies regarding pharmaceutical promotion. One is the management strategy, saying we have to work with pharmaceutical industry, so there is nothing to do, and we will do our best. So we will maybe write a charter, but no, we won't change anything, and it's kind of statu quo convince people. But there are other people more in this investment approach who are pushing for more independence, and it's not easy. Maybe it's not possible to be totally independent, but there is much room for improvement and for doctors to get away from this influence with independent drug bulletins, with not accepting gifts or being more critical. Many things to do. So it would be more my position, and it's the position of many great people like Marcia Angel and others. I invite you to read. What about international conferences sponsored by drug companies, critical participation or withdrawal? It's a very important, interesting topic. I would recommend you to read the paper from Alfredo Pisacane, an Italian doctor who wrote in the British Medical Journal in 2008 a paper entitled Rethinking Continuous Medical Education. It's a very great paper for me. And about international conferences sponsored by drug companies. And the fact is that with the literature, it shows that this kind of big conference, the doctors are not really learning very important things. It's not they are not learning things that change their behavior in their practice. Certainly, it's important to meet people. There are things that make that it's important for doctors to meet, but on really for the quality of care and for the medical practice, it's not really effective. So I don't think that, and I think it's important to withdraw this kind of conferences, sponsored conferences, but some of them are also, it can also be interesting to participate with a critical approach and to stand and to speak up critical things in the audience. Maybe, yes, it's already a very interesting stand, and another stand as just being participants to an influenced and maybe biased presentations and conferences. There is two more questions, and maybe we will finish after them. Maybe with training and influence, we need to adopt and inoculate students and booster for established doctors with continuing medical education points for taking part. It's absolutely necessary that doctors, for me, change their way to do their continuing medical education. I think that the no-fringe group, which worked the most on this topic, is Found Out in the US. It's one of their big part, continuous medical education. So I suggest you to go on their website, Found Out, and you will find many resources on this topic. Speaking about the European context, are there any actions currently taken at the EU level, considering that Big Pharma is also trying to influence EU policies in Brussels? And there are not many actions on the European level, and it's one of our hope and goal for the no-fringe network, that this kind of connecting dynamic will lead to more European level actions. but currently there are no one. But there are people who are working on the European level, and you can read, for instance, the reports of Corporate Observatory Europe, who really does a great watch on the lobby activities in Brussels. So they published 2 reports on drugs and pharmaceutical industry in the last years. So you will find them on their website. And there is also people connected to prescriber, and there were an action in the last months asking for more transparency. I think it was about clinical trials. I don't remember exactly. I think it was linked to EMA, to the European Medical Agency, and there were concerns about transparency on with the EMA and some organization with prescriber, Formindep, and I think we were 60 organizations or something like that. We asked for clarification on what was going on with EMA and on this step, and we sent them to the ombudsman. You know, in Europe there is someone, the ombudsman, who you can contact, and he will see if things are well done or not. And so I think we got an answer telling us that thing was respected in a way. So it was more, it was okay for this point. So there are no other questions. I'm very glad for this webinar. I thank you all for participation, and I hope that it will lead in action in your countries. And please write to me, to Formindep, and to Health Action International to tell us what you are doing, and also if you have questions, of course. Bye-bye.
Hello, I'm not sure if, just as you were finishing, Paul, my headphones started playing up, so I'm hoping that you can hear me and see me. But thank you so much for speaking today. It was really informative. I had a link in the chat to your slides that people can find, but you can also find them on our website. So that's highweb.org, and go to our events page. And if you look at the event from today, then you'll be able to find all slides. But again, thank you so much. We would love for you to answer, for all of the participants, to answer a survey that should pop up when you exit the screen, but I will also put it in the chat. The survey just gives us a bit of information about who was here, and also, you know, how you found today's presentation. So I would just put that in the chat just now.
Can I add something? One point?
Of course.
Yes. I forgot, but because I had I just want to mention that in my PowerPoint at the end, there are some slides about official stance from the European Council, for instance, from the National Academy in the US on this topic of medical education and conflict of interest, so that people can use them if they want. And the other thing that I wanted to say is that I will maybe this year be the the Preventing Overdiagnosis Conference in Oxford in September. I hope it will be not cancelled. And it's a very also interesting, important meeting where connected with all these issues. And I encourage people, and especially students, to go there.
Lovely. Thanks, Paul. That's awesome. Okay, well, I have just posted the...
Okay, I think we just lost Dimity, our co-host, but I think we actually talked about everything that was left to talk about. Dimity posted the link into our chat. We will also publish the recording on our website if you want to rewatch the webinar. And yeah, for now, thanks for all of you, to all of you for attending, and hope to see you soon again in one of our next webinars. Goodbye.
Bye-bye.